Welcome back, folks. My name is Taj, Medicare sales agent, advisor, and consultant, back with another video bridging the gap between the senior demographic and Medicare sales agents. In today's video, we'll be going over another secondary Medicare option known as Medicare supplement plans, also known as Medigap plans, what to know about them, and for who they're best. Now, if you're new to Medicare, I recommend checking out my other video in the top right corner to gain some foundational knowledge, and then join us back over here. Without any further ado, let's get right into it. Medicare supplement insurance, Medigap, is an extra insurance a person can buy from a private insurance company to help pay their share of out-of-pocket costs in original Medicare. Now, a private insurance company can be a company like Humana, United Healthcare, Aetna, Cigna, WellCare, WellPoint, the list goes on. A person can only buy Medigap if they have original Medicare. A Medigap policy only covers one person, so if a married couple both want Medigap coverage, they'd each have to buy their own policy. For people shopping around for a Medigap plan, there are a plethora of companies out there. I recommend sticking with a reputable brand. The reason being, you'll have peace of mind knowing that they're less likely to go out of business and have the ability to cover your medical costs compared to a mom and pop or a regionally known company. For those with a Medigap policy and get care, Medicare will pay its share of the Medicare approved amount for covered healthcare costs. In most Medigap policies, there's an agreement to have the Medigap insurance company get your Part B claim information directly from Medicare. Then your Medigap policy will pay your doctor whatever amount you owe under your policy, and you're responsible for any costs that are left. Some Medigap insurance companies also provide the service for Part A claims. If a Medigap insurance company doesn't get a beneficiary's claims information directly from Medicare, their doctors need to be asked if they participate in Medicare. This means that they accept assignment for all Medicare patients. If an individual's doctor participates, their Medigap insurance company is required to pay their doctor directly if asked to. Now, once a policy is purchased, a beneficiary will keep it as long as they pay their Medigap premiums. All standardized Medigap policies are automatically renewed every year, even if the beneficiary has health problems. A Medigap insurance company can only drop someone if they stop paying their premiums, they weren't truthful on the Medigap policy application, like about their health, and the insurance company goes bankrupt or goes out of business. All right. When someone is getting started with Medicare, they can either buy a Medigap or enroll in a Medicare Advantage plan, but a person cannot have both. There is a 6-month Medigap open enrollment period, which starts the first month a person has Medicare Part B and is 65 years of age or older. During this time, they can enroll in any Medigap policy, and the insurance company can't deny them coverage due to pre-existing health problems. After this period, they may not be able to buy a Medigap policy, or it may cost more. A Medigap open enrollment period is a one-time enrollment. It doesn't repeat every year like the Medicare open enrollment period that you may be familiar with from October 15th through December 7th of every single year. All Medigap policies are standardized. This means policies with the same letter offer the same basic benefits no matter where a person lives or which insurance company they buy the policy from. There are 10 different types of Medigap plans offered in most states, which are named by letters A through D, F, G, and K through N. Price is the only difference between the plans with the same letter that are sold by different insurance companies. If someone has a Medigap policy and joins a Medicare Advantage plan for the first time, they may want to drop their Medigap policy because they'll be paying for coverage they can't use. If after they join a Medicare Advantage plan for the first time and are not happy with their plan, they'll have a single 12-month period, a trial right period, to get their Medigap policy back if the same insurance company still sells it once they return to original Medicare. After that period, they might have to wait to drop their Medicare Advantage plan and might not be able to buy a Medigap policy, or it may cost more. Something to be aware of, but you do have that option available to you. For whom is a Medicare supplement plan? A Medicare supplement plan is for those with a high monthly income, preferably with at least $150 to $200 that can be dedicated to monthly premiums for a Medigap plan. This amount can vary widely depending on the state someone resides in, the company they decide to go with, or if they are in need of additional benefits such as dental, hearing, and or vision coverage. It's also for those who do not have to worry about paying copays for some of their hospital and medical care, and for folks that may travel regularly in a year or spend some amount of time away from their resident county. If someone has TRICARE for life, fundamentally, it doesn't make sense to have a Medigap plan because TRICARE already allows them to see civilian doctors and covers a large portion, if not all, of their medical costs. So they'd be paying unnecessarily for a Medigap plan. Lastly, a Medicare supplement plan can also be for those who have VA benefits and enough monthly income to support the Medicare supplement premiums mentioned earlier. The reason why this could work is because the Medicare supplement plan will give them access to civilian doctors, giving them more versatility in their healthcare needs, and out-of-pocket costs will be lower than most who do not qualify for VA benefits because they will have to help with coverage of medications through VA. That sums up Medicare supplement plans and who they might be best for. That's it for today, folks. If you found today's video helpful, help me help you and others by subscribing, liking, and sharing this video. If you have any questions, comments, or concerns, please feel free to leave a comment below, and I'll get back to you as soon as I can. Thanks for watching. See you in the next one.